Hello guys, welcome to my YouTube channel. Join me as I explain common causes of trauma and its remedies. On a daily basis, we have traumatic cases which can be taken care of by ourselves, or we can do the little we know before we get to an eye doctor. Number one, cut or scratch on the eyeball due to insect pests on the eyeball. This occurs mostly to people that always on motion, like motorcycle, vehicles, or even divers. Those kind of traumas occur to them when there is a sharp pest of an insect or projectiles. This will lead to pain and other symptoms. Proper treatment for this particular trauma is removal of the insect by the individual if the person can handle it. But if he cannot handle it, go to eye doctor for a proper treatment. Number two, chemical exposure. Most of our daily activities, we use cleaning agents like bleach, detergents, and most of those things, indirectly, we can expose our eyes to them. Forcefully, when there is splash of chemical on the eyeball, it induces trauma or injury on the eyes. Best treatment is proper irrigation of the eyes. Use a very clean water to wash the eye thoroughly. Then you have to meet an eye doctor for proper treatment. Number three, explosive. Explosive is the common cause of trauma on the military zone or urban combat. The best treatment is first aid, then take the patient to the eye doctor for proper treatment. Number four, sports injury. Sports injury is another common cause of trauma for people that are into sports, especially during training. They experience a whole lot of trauma that induce pains, redness, and other symptoms. The best treatment for sports injury is first aid and take the patient to an eye doctor for proper treatment. Number five, which is the most common cause of trauma in our daily basis, blunt trauma. Blunt trauma have indirect or direct blunt trauma. Direct blunt trauma, when an individual has a direct blow on the eyeball or the eyelid or surroundings of the eyeball. This is called blunt trauma. There is a direct blow to the eyeball. Best treatment is to take the patient to an eye doctor for a proper treatment. Indirect trauma. This occurs when an individual involves in accident or falls from a tree height or that induce trauma on the eyes. The best treatment for indirect trauma is first aid and take the patient to eye doctor for proper treatment. I hope this has educated you. All these traumas can lead to endophthalmitis and panophthalmitis if they are not properly taken care of, especially blunt trauma. Make sure you visit an eye doctor for any type of trauma because all of them can lead to endophthalmitis or panophthalmitis. That is total damage of the eyeball if it's not properly managed. And some of them can subside their symptoms when you have taken first aid. But it's ideal that you go and meet an eye doctor for proper management to avoid endophthalmitis, panophthalmitis in future. Thank you very much for staying through my video. Please don't forget to subscribe, share, and like. I love you all.